Hello everyone, welcome to another informative video. Our today's topic of discussion is something that impacts the lives of millions of people on daily basis, and that is asthma. So asthma is more than just a health condition. It's about the ability to breathe, to chase your dreams and to enjoy life to the fullest. But living with asthma or knowing someone who does can sometimes feel like a challenge. That's why it's crucial to understand this condition inside out. Now let's talk about what is asthma. So asthma is an inflammatory disease of the airways to the lungs. It makes breathing difficult and can make some physical activities challenging or even impossible. So to understand asthma, it's necessary to understand a little bit about what happens when you breathe. So normally, with every breath you take, air goes through your nose or mouth down into your throat and into your airways, eventually making it to your lungs. So there are a lot of small air passages in your lungs that help deliver oxygen from the air into your bloodstream. Asthma symptoms occur when the lining of your airways swells and the muscles around them tighten. Mucus then fills the airways, further reducing the amount of air that can pass through. So these conditions can bring on an asthma attack, which is coughing and tightness in the chest that's typical of asthma. Now let's talk about the symptoms of asthma. So the most common symptom of asthma is sneezing. Other symptoms include coughing, especially at night, when laughing or during exercises, tightness in the chest, shortness of breath, difficulty in talking, anxiousness or panic, chest pain, rapid breathing, frequent infections, trouble sleeping and fatigueness. So these are the symptoms of asthma. Now let's talk about causes and triggers of asthma. So number one cause of asthma is genetics. If a parent or sibling has asthma, then you are more likely to develop it. Number two cause is history of viral infections. So people with a history of severe viral infection during childhood, such as respiratory syncytial virus infection, may be more likely to develop the condition. Number three is hygiene hypothesis. So this theory explains that when babies aren't exposed to enough bacteria in their early months and years, the immune system don't become strong enough to fight off asthma and other allergic conditions. So these were the causes of asthma. Now many factors can also trigger asthma and the symptoms to worsen. So triggers of asthma can vary and some people may be more sensitive to certain triggers than others. So it includes health conditions such as respiratory infections, exercise, environmental irritants, allergens, intense emotions, extreme weather conditions, pests, certain medications including aspirin or non-steroidal anti-inflammatory drugs. Now let's talk about diagnosis of asthma. So there is no single test or exam that will determine if you or your child has asthma. Instead, your doctor will use a variety of criteria to determine if the symptoms are the result of asthma. So the following tests they can help diagnose the trusted source of asthma. Number one is health history. So if you have family members with the breathing disorder, your risk is higher. Alert your doctor to this genetic connection. Number two, physical exam. Your doctor will listen to your breathing with a stethoscope. You may also be given a skin test to look for signs of allergic reaction such as hives or eczema. Allergies increase the risk of asthma. Number three, breathing test. Pulmonary function tests measure airflow into and out of your lungs. For the most common test, spirometry, you blow into a device that measures the speed of the air. So doctors, they don't typically perform breathing tests in children under 5 years of age because it's difficult to get an accurate reading. Instead, they may prescribe asthma medication to your child and wait to see the symptoms improve. So if they do, your child likely has asthma. For adults, your doctor may prescribe a bronchodilator or other asthma medication if test results indicate asthma. If symptoms improve with the use of this medication, your doctor will continue to treat your condition as asthma. So till now we have talked about what is asthma, what are the symptoms, causes, triggers and diagnosis. Now let's talk about types of asthma. Number 1 is allergic asthma. So allergen triggers this condition type of asthma, and these might include pet dander from animals like cats and dogs, food, mold, pollen, dust. Allergic asthma is often seasonal because it goes hand in hand with seasonal allergies. Number 2 is non-allergic asthma. Irritants in the air are not related to allergies trigger this type of asthma. These irritants might include burning wood, cigarette smoke, cold air, air pollution, viral illness, air fresheners, household cleaning products and perfumes. Number 3 is occupational asthma. Occupational asthma is a type of asthma that include by trigger in the workplace. So these includes dust, dyes, gases and fumes, industrial chemicals, animal proteins, rubber, latex. These irritants can exist in wide range of industries including farming, textiles, woodworking and manufacturing. Number 4 is exercise-induced bronchoconstriction. So exercise-induced bronchoconstriction usually affects people with a few minutes of starting exercise and up to 10 to 15 minutes after physical activity. So this condition was previously known as exercise-induced asthma. So up to 90% of people with asthma also experience exercise-induced asthma, but not everyone with EIB will have other type of asthma. Number 5th is aspirin-induced asthma. So aspirin-induced asthma, also called as aspirin exaggerated respiratory disease, is usually severe. It triggers by taking aspirin or another NSAIDs such as naproxen or ibuprofen. So the symptoms may begin within minutes or hours. People with aspirin-induced asthma also typically have nasal polyps. About 9% of people with asthma have aspirin-induced asthma. It usually develops suddenly in adults between the age of 20 to 50. Number 6 is, in this type of asthma, symptoms worsen at night, and it is nocturnal asthma. So triggers that are thought to bring on symptoms at night include heartburn, pet dander, dust mites. The body's natural sleep cycle may also trigger nocturnal asthma. Number 7 is cough variant asthma. So cough variant asthma doesn't have classic asthma symptoms of sneezing and shortness of breath. It is characterized by persistent dry cough. So if it's not treated, cough variant asthma can lead to full-blown asthma flares that include the other more common symptoms. Now let's talk about what is an asthma attack. So when your asthma symptoms get progressively worse, it's known as an exacerbation or an asthma attack. It becomes increasingly difficult to breathe because the airways are swollen and the bronchial tubes have narrowed. So the symptoms of exacerbation may include hyperventilation, cough, sneezing, shortness of breath, increased heart rate, agitation, confusion and blue lips. So although an asthma attack can end quickly without medication, you should contact your doctor because it can be life-threatening as well. So the longer an asthma attack continues, the more it can affect your ability to breathe. That's why asthma attack often requires a trip to the emergency room. Asthma attack can be prevented by taking medications that help manage your asthma symptoms. Now let's talk about treatment of asthma. So treatment of asthma, it falls into 4 primary categories. Number 1 is quick relief asthma treatment. So these medications should only be used in the event of asthma symptoms or an attack. They provide quick relief to help you breathe again. So it includes bronchodilators. So bronchodilators, they work within minutes to relax the tightened muscle around your airways and decrease the symptoms quickly. Although they can be administered orally or injected, bronchodilators are most commonly taken with an inhaler or nebulizer. They can be used to treat sudden symptoms of asthma or taken before exercise to prevent a flare-up. Then we have number 2 is first aid asthma treatment. So if you think that someone you know is having an asthma attack, tell them to sit up straight and assist them in using their rescue inhaler and nebulizer. The dosage will vary depending on the medication. Check the instruction insert to make sure you know how many puffs of medication you need in the event of an attack. So if symptoms persist for more than 20 minutes and a second round of medication doesn't help, seek emergency medical attention. And if you frequently need to use quick relief medication, ask your doctor about another type of medication for long-term asthma control. Number 2 comes long-term asthma control medications. So these medications are taken daily to help reduce the number and severity of your asthma symptoms, but they don't manage the immediate symptoms of the attack. So long-term asthma control medication, they include anti-inflammatories, anticholinergics and long-acting bronchodilators. So anti-inflammatories, when they are taken with an inhaler, corticosteroids and other anti-inflammatory medications, they help reduce the swelling and mucus production in your airways, making it easier to breathe. Number 2 is anticholinergics. These help stop your muscles from tightening around your airways. They are usually taken daily in combination with anti-inflammatories. And number 3 is long-acting bronchodilators. So these should only be used in combination with anti-inflammatory asthma medications. Number 4 is bronchial thermoplasty. So this treatment uses an electrode to heat the airways inside the lungs, helping to reduce the size of the surrounding muscles and prevent it from tightening. This minimally invasive procedure is performed by a doctor in a clinic or hospital and usually takes around an hour. So bronchial thermoplasty is intended for people with severe asthma and can provide relief from symptoms for up to 5 years. Now let's talk about prevention and management. So in addition to using maintenance medications, you can take these steps each day that help you make yourself healthier and reduce your risk of asthma attacks. So these includes eating a healthier diet. So eating a healthy, balanced diet can help improve your overall health. Number 2 is maintaining a moderate weight. Asthma tends to be worse in people with overweight and obesity. So losing weight is healthy for your heart, your joints and your lungs as well. Number 3 is quit smoking. So if you smoke, irritants such as cigarette smoke can trigger asthma and increase your risk. Number 4 is exercising regularly. Activity can trigger an asthma attack, but regular exercise may actually help reduce the risk of breathing problems. Number 5 is managing stress. Stress can be a trigger for asthma symptoms. Stress can also make stopping an asthma attack more difficult. And number 6 is nutrient-rich foods. So nutrient-rich foods, they are vital to help reduce the symptoms, but food allergies can trigger asthma symptoms. So till now we have discussed everything in detail that you should know and one should be aware about asthma. So to conclude, I hope you find this video not only informative but also empowering. Asthma may be a part of your life or someone you know, but remember, knowledge is the first step to better management. So if you found this video helpful, please do share it with someone who may benefit from this knowledge. Let's spread awareness and make a difference together. So as we conclude our discussion on asthma today, remember your health is your greatest wealth. So take care of yourself, stay informed and keep breathing easy. Thank you for being a part and do not forget to like, share and comment to our YouTube channel Nick Neha Vlogs.